A boy pulling a canoe on the Niger River credit Mohamed Yves Diarra by Essay 4.0. Among the many bizarrities of the COVID years was the sudden demonization by major media outlets of Ivermectin, one of the most used medicines on earth, which just helped Niger to become the first country in Africa to eradicate a debilitating parasitical disease. Onchocerciasis, or river blindness, is spread via the filarial parasite Onchocerca volvulus, transmitted to blackflies which breed near fast-flowing rivers. At its ugliest, it can cause severe skin disfigurations, permanent blindness, and epilepsy. Present in 26 African countries as well as parts of Brazil, Venezuela, and Yemen, its transmission was severely reduced in the Americas following wide-scale distribution programs of ivermectin starting in the 1980s, called the Mechanism Donation Program (MDP), managed by the World Health Organization. This wide-scale ivermectin treatment has continued until present day, such that this year, on Wild Neglected Tropical Disease Day Jam 30th, Niger was confirmed and honored as the first African country to eradicate onchocerciasis, which they achieved through a 4-decade ivermectin administration, an activity that also eradicated the elephant man disease lymphatic filariasis. Niger is one of the poorest countries in the world, but with simple strategies and an effective medicine was able to replicate the success seen in much wealthier countries like Colombia and Mexico. Though dry in many places, the Niger River is a major African river system that is a hotbed for tropical diseases. The report lauded the country's strong national disease control leadership in the program and cross-border partnerships in helping to eliminate the two diseases. More stories like this. New mosquito nets prevent millions of malaria cases in insecticide-resistant areas over the last 3 decades. Nearly everyone in Bangladesh gained access to basic electricity. It declares Kenya freed of this deadly tropical parasite after decades of suffering. Senegal has also ended the mass treatment phase and is moving into a period of monitoring and targeted response, but Niger successfully navigated during its journey to eradication. This achievement highlights the power of strong public-private partnerships and the impact of coordinated efforts between communities, governments, and stakeholders, reads a report on the program published in the weekly Epidemiological Records. The NDP, the longest-running large-scale medicine donation program in history, has been central to this success, providing a model for other global health initiatives.